This public service announcement comes to you from the local health department here in Boston. Chlamydia has been on the rise over the past few years, especially among young people, particularly young women. Chlamydia is the most common STI, and its incidence has increased by 62% across the U.S. since 2000. In Boston, chlamydia is 4 times more likely among those aged 15 to 24 than the rest of the population. Among those aged 15 to 24, 70% of chlamydia cases are reported by females. Blacks and Latinos are 7 to 11 times more likely to contract chlamydia than the white population in Boston. We as a public health community urge young people to practice safe sex. Condoms are available for free at the Planned Parenthood on Commonwealth Avenue or at the Boston University Student Health Center. You can also purchase condoms at most pharmacies throughout the city. If you think you may have chlamydia, see your healthcare provider immediately to avoid spreading it to someone else. Because chlamydia can often go undetected, it is important to get regular STD screenings, even if you feel you have been completely safe. As a community, we are working to improve education and knowledge surrounding safe sex practices. Boston Public Schools are encouraged to create a sex education curriculum that fosters openness and the comfort to engage in honest discourse. Community centers should be encouraged to create spaces and activities for teenagers to engage in after school. The Boston Public Health Commission currently runs school-based health centers where they screen students for STIs and provide sex education. Students and educators are asked to reach out to the BPHC if they would like a school-based health center at their institution. Parents are also urged to talk to their children about safe sex practices. The Infectious Disease Bureau and the Massachusetts Department of Public Health are collaborating to improve data collection to ensure the accurate reporting of chlamydia among various demographics. This way, we can effectively target those at highest risk for contracting the disease. The Infectious Disease Bureau is also working closely with local teenagers to raise awareness through social media platforms. The health department has also shifted its focus towards more vulnerable populations, including the homeless and those with intellectual and developmental disabilities. Service providers working with these groups are going to be trained in the provision of sexual health education, and the city is increasing the amount of agencies that offer condoms for free. Systemically, it is important to decrease the socioeconomic gap in Boston to ensure that every member of our community is receiving the same education and opportunities. Sexism and a lack of empowerment has led to higher rates of STDs in women, particularly women of color. Do not be afraid to speak out if you or someone you know is being sexually abused, assaulted, or harassed. Empowerment among our younger population will lead to decreased risk-taking behaviors and increased respect towards young females. Boston follows the Healthy People 2020 goal to promote healthy sexual behaviors, strengthen community capacity, and increase access to quality services to prevent sexually transmitted diseases and their complications. It is recommended that sexually active women under the age of 24 get regularly screened for chlamydia. Remember, safe sex and regular screenings go a long way in preventing chlamydia.